I want to welcome you on behalf of the Bay Area Saving Lives campaign. We are thrilled to have this critical conversation and to learn about Cuba's approach to provide healthcare for all, and how this small but mighty island nation is confronting the COVID-19 pandemic, both locally and globally. My name is Angelica Salazar, and I have the great honor to moderate today's conversation with all of its technical difficulties with some very distinguished experts. One of our objectives is in the next hour and a half, you will have learned some about Cuba's health system, how they are combating COVID-19, and even log off feeling more hopeful by the valuable lessons, best practices, and achievements that Cuba exemplifies and shares with the world as we all collectively confront this global pandemic. But before we get started, I want to ground us. Today is International Earth Day, and I want to honor our Mother Earth and remind us that her first sacred medicine is water, clean water. Now, a bit of logistics. We have a lot of essential folks behind the scenes. You're seeing a lot of them on our screens right now. So you know that this was a big virtual production. I want to give a loving shout out to them, and also our two interpreters, Beth and Hasmin. Again, should you want to listen to the Spanish channel, please message us at the question and answer function. Si quieres escuchar el canal en español, por favor, mándanos un mensaje, el botoncito que dice Q y A. Our agenda is packed, so I have the fun task of keeping us moving through it. To start off our brilliant conversation, we will hear some welcoming words from a very special guest, the Cuban ambassadors to the United States, the Honorable Lianes Torres Rivera, bienvenida. And then we will watch only about 10 minutes of a must-watch 1 hour-long documentary called Cuba and COVID-19, Health Science and Solidarity. Following this film teaser, we will have another special guest, Nurse Deborah Berger, a president of the National Nurses United. And then we will dive into a dialogue with our co-producers of the film, our featured speakers, Dr. Rodriguez and Dr. Yaffe. We will have some time before also to speak with and welcome Dr. Knight, a US graduate of Cuba's Latin American School of Medicine. From the audience, but unfortunately time is limited. So as a follow-up to this event, the Bay Area Saving Lives campaign will send an email full of resources, including the full film and ways you can get involved. If you do have a question for our speakers, please submit those to the Q&A function rather than the chat. We will turn off the chat for most of the conversation, and we will reopen it again towards the end for more exchange. We hope that in this event, there's an opportunity for exchanging ideas as well as upcoming Cuba-related events and ways we can strategically organize to change US policies towards Cuba, right? So without further ado, I would like to start today's event with a welcome to the Cuban ambassador of the United States, Ambassador Lianes Torres Rivera, who took up her duties in January, concurrent with the transition to the Biden administration, and was one of the first groups of diplomats to present credentials for approval. Ambassador Torres Rivera has served as a diplomat in Denmark, Malaysia, and Vietnam. And from 2015 to 2017, she was part of the Cuban delegation that met with the US government authorities to discuss the reestablishment of diplomatic relations and the reopening of embassies under President Obama. Ambassador Torres Rivera is the first woman from Cuba to serve as the ambassador to the United States, and only the second to hold the role in nearly 60 years since the Cuban intersection in Washington, D.C. became a full-fledged embassy in 2015. Embajadora, Muchas felicidades y muy bienvenida. The floor is yours.
Thank you, Angelica, and good afternoon for you and for everyone that is sharing this a wonderful webinar this afternoon. Well, thank you for arranging this webinar on such an important subject for humanity today, the COVID-19 pandemic. Thank you for the invitation to share with you the efforts and expertise of Cuba in this long battle. There has been challenges and lessons learned by Cuba and certainly by many other countries since COVID-19 broke in 2020. Confronting COVID-19 has not only brought about postponing goals and transforming life objectives in all sectors and nations, but also involve constantly redefining strategies and ways of doing things in the search for better disease control and a sustainable economic performance. Although public health has been one of the sectors most affected as a result of SARS-CoV-2 at this time, we can say that the crisis has affected the most diverse scenarios and has posed a huge challenge for humanity, which had never experienced a pandemic caused by a coronavirus before. Hundreds of millions of people have lost their jobs, of livelihoods, of have been thrown into poverty or extreme poverty in various regions, even in rich countries. In Latin America, CLAC has assessed that as a result of the pandemic, the region has regressed at least a decade in its economic performance and with serious consequences for all countries. Many people wonder how Cuba, being a small country with scarce resources under an economic war which has even worsened in the midst of the pandemic, has managed to face this new challenge. The arrival of COVID-19 in Cuba did not take our government by surprise. From the very moment that the virus posed a threat to the population, measures were adopted aimed in the first place at saving life, and an essence that of course has defined a revolution for more than 60 years. The approach to this epidemiological situation has three essential elements in our case. The expressed political will that people's health is a priority, government management, and as well as risk prevention and anticipation. Long before the detection of the first cases in our country, relevant actions had already been designed to contain the disease, based on a broad national plan for the prevention and control of the new coronavirus. Mass organization and agencies participate in its preparation. This plan, as many of you know, has been updated depending on the evolution of the epidemic in the country. We can also add that from the first moment, the government validated a science and innovation-oriented management system, which connected productive and service sectors with those of knowledge. We count on the capacities created throughout these years of revolution in terms of infrastructure and human capital to support the plan's implementation. In addition, we can say that we have a national health system that is free, accessible, regionalized, comprehensive, non-discriminatory, and with community and intersectoral participation, which is based on primary health care, where the family doctors and nurses are its main strength. The wide network of institutions and services designed allows to provide health coverage to 100% of the population by means of the operation of more than 1,000 family doctors and nurse offices, 449 polyclinics, 150 hospitals, and 12 research institutes, among other institutions. The fact that the country has a potential of 9 doctors for every 1,000 inhabitants has been essential. It has also been decisive the use of innovative product, equipment, and Cuban supplies. I'm sure you will be talking about some biotech drugs that we are using nowadays in Cuba to treat patients that have been affected by COVID-19. And in this regard, we can also say that we are in the middle of Cuba have 5 vaccine candidates, and we are in the middle of a phase 3 of clinical trials of 2 of them. I had one, Soberana 02, and we always said that Cuba will be one of the first or the first Latin American countries counting with its own vaccine. We are planning to have our whole population immunized by the end of the year of 2020, which is a big challenge, but we will do it, I know. And finally, finally, if we talk about solidarity, I think it is essential to mention the help provided by 57 Cuban medical brigades, part of the Henry Reeve International contingent of specialized doctors in disaster situation and serious epidemics. And that's it. This is what Cuba has done to face the pandemic. There are more information, detailed information about all the system that we put in place to fight against this virus. And what you need to know is that all this has been done with great effort and huge limitations due to the blockade. So thank you so much for your attention. I will be here the whole webinar. Thank you.
It is such an honor, Embajadora. Thank you again for joining us and for grounding us in that history, that noble history. We look forward to making US-Cuba her story with you in the next years. Before we get started watching the documentary, it's important to say that it was produced in some incredible circumstances in the midst of a pandemic, while Cuba was in full quarantine and had its borders closed. As we say, a lo cubano, with true perseverance, the film producers, Dr. Valia Rodriguez and Dr. Helen Yaffe, with their brilliant and persistent production team, Danny Films, and in collaboration with Belly of the Beast, this documentary really shares the frontline stories ranging from a Cuban family doctor to a Cuban family who survived COVID-19. You will hear stories from a dynamic group of medical students doing active door-to-door screenings, to even a doctor who was part of the heroic medical contingent that traveled to the first pandemic epicenter in Lombardy, Italy. And before we start the documentary, I also want to say that this documentary also shares insider firsthand interviews with some of Cuba's top biotech scientists who are designing, developing, producing COVID-19 vaccines, as the ambassador explained, as well as treatments and other life-saving medical equipment like ventilators. Quite impressive, right? So now let's all virtually travel to Cuba for roughly the next 10 minutes. Let's go. We are going to keep the show running with or without the 10-minute film teaser. And since we are so grateful to have the a president of the National Nurses United, I will go ahead and introduce her. So as I mentioned, we will send out the link to the full documentary after this event. And we will soon be having, and I wanted to wait until they all arrived here with us, which is probably in the next 10 minutes or so because they're in a staff meeting. We will soon be having a number of nurses from around the country joining us, and they'll be zooming in from their staff meeting. So in the meantime, I'm going to go ahead and introduce a president of the National Nurses United, a nurse herself, Deborah Berger. I want to take some time to also uplift and honor the National Nurses United and their tremendous leadership in advocating in healthcare for all and demanding since the beginning for a comprehensive federal plan to combat the COVID-19 pandemic. National Nurses United was founded in 2009, and today with more than 170,000 members nationwide, it is the largest union and professional association of registered nurses in US history. Now we will welcome today one of the NNU's co-presidents, Deborah Berger, who has been a nurse for over 45 years. And we are so grateful to have her share the insight of nurses from across the United States. Thank you, President.
Good afternoon. My name is Deborah Berger, and I am one of the presidents of National Nurses United. And our union is proud to co-sponsor this timely discussion of the practice of science, public health, and solidarity in Cuba. In 2018, leaders of our union visited Cuba to learn about Cuba's universal healthcare system. As you saw in the film, however short, I hope you take the time to see the whole film. Despite the economic constraints caused by nearly 6 decades of the US embargo, the Cuban government has prioritized healthcare and a system that is deeply committed to ensuring that all people have access to the care they need. Ambassador Torres Rivera explained in detail, quite a bit of detail, how people access healthcare in that system. And in the United States, however, our market-driven system of private insurance creates tremendous barriers and leads to tens of thousands of unnecessary deaths every single year. As nurses who devote ourselves to advocating for the health and well-being and dignity of all people, you can imagine the envy we felt when we visited Cuba's neighborhood clinics and learned that the doctors and nurses proactively show up at patients' homes when they miss their appointments or overdue for their checkups. They know them by name. They're personal people to them. They even assigned a doctor and a nurse team to ensure that the health of Cuba's visitors at the large hotels were taken care of, and a couple of our staff members even had hotel room visits by doctors and nurses when they became ill there. We are in awe of Cuba's investment in improving social determinants of health. Social factors that cause poor health in our country are mitigated in Cuba by guaranteed free education and by Cuba's commitment to making sure that all people are honored and fed and housed. It was truly amazing when we were there. We saw no one sleeping in the streets, no one desperate for food, no one begging for handouts because they had the resources they needed. We were amazed when we visited Cuba's Center for Genetic Engineering and Biotechnology, which has achieved stunning achievements and advances in curative treatments that could run circles around US therapies, which now include development of 5 promising COVID vaccines, all despite restraints on materials and equipment imposed on Cuba by the US embargo. As a diabetes case manager at one point in my career, I saw at these facilities that they had developed treatments for diabetic ulcer wounds that prevented amputations. And it broke my heart that our citizens in the US wouldn't be able to have access to those treatments. It's truly cruel and inhumane. As you've heard, I've been a nurse for over 45 years, and I can honestly say that this past year, dealing with outright negligence and lack of preparedness of the US healthcare system has been one of the most challenging and heartbreaking in my years of life as a nurse. It's difficult enough to deal with the pandemic, but nurses and other frontline workers have also been fighting for their own lives while witnessing the unnecessary death of hundreds of thousands of patients, losing over 3,700 healthcare workers, and mourning the death of their colleagues, 383 RNs deaths, which were totally unnecessary. We have been fighting tooth and nail for our patients and for our communities against an industry that continues to restrict our access to necessary protective gear, has attempted to use this pandemic to crush hard-won safe staffing ratios, and prioritizes profits over patients at every single turn. Cuba shows us another way: solidarity, science, and public health. Cuba's commitment to saving lives, not just on the island, but also across the world with the Henry Reeve International Medical Brigade, puts our country's healthcare industry to shame. Cuba is a living example of a country whose people have come together collectively to make a decision that care for one another is more important than profiteering off of the suffering of many. Cuba demonstrates that a country makes it a priority to care for its people. It can and will care for its people. We in the United States need to make that same decision to care for our people. Our nurses are leading the fight for Medicare for all in this country because we believe that we too are capable of building the compassionate, moral, and political will that it will take to win guaranteed health care for everyone in this country. Cuba has a lot to teach us about how we can get there from here. Thank you for joining us in this important conversation today and for supporting the Nurses Campaign for Medicare for All. I know that if we stand up and take this to the streets, we can accomplish getting Medicare for all in this country. Thank you so much for inviting us for this important discussion.
Thank you, President. Thank you, President Berger, for your words and for the work that you all do. I am now aware that we have around 200 plus or so nurses that are Zooming in from their staff meeting. And so I just want to take a moment to not only welcome them, but applaud them for their essential and critical work. And we hold deeply in our hearts the thousands, the several thousands, as you mentioned, President, of healthcare workers across this country that have given their lives to combat COVID-19 while saving lives. So thank you again for your leadership. And I believe we figured out our technical issues. So we are going to try to relaunch that short bit of the documentary that is featured for this conversation. So Cheryl, feel free and take it away. Thank you.
Nosotros tenemos una amiga que muy querida por nosotros, que vive en España, y el día 13 de marzo ella llegó a Cuba y a los 2-3 días comenzó a sentirse malestares propios de la enfermedad, acudió al médico, la ingresaron, por supuesto, le diagnosticaron el COVID y nosotros entonces tuvimos que también ingresar para que se nos estudiara, a ver la posibilidad que había de que también nos hubiéramos contagiado y así fue. Quedamos contagiados en ese entonces.
La especialista de epidemiología del municipio nos comentó que nuestra amiga había sido positiva. Ellos vinieron en una ambulancia, nos recogieron aquí en la casa y nos trasladaron hacia el hospital. O sea, hay un sistema de la salud pública que cuando hay alguien contagiado se recoge en su casa o posible contagio y se traslada hasta el hospital que se...
De allí no podíamos movernos, no nos iban a dejar salir del hospital. Sucediera lo que sucediera. Estábamos bajo un régimen de aislamiento y de tratamiento que es inviolable y no íbamos a poder salir de allí.
Realmente fue muy triste porque estábamos, imagínate, encerrados también. Después ya nos separaron. Mi papá se fue a terapia, estuvo en terapia intensiva casi más de 10 días, entubado, entonces, y crítico además, un riesgo de muerte. Entonces, para nosotros fue realmente una experiencia súper fuerte. Yo creo que es una de las experiencias más fuertes que yo he vivido en toda mi vida.
En Cuba nosotros no competimos entre las instituciones, al contrario, colaboramos, nos potenciamos, nos apoyamos mutuamente. Esa es una característica de la ciencia en Cuba. Es un país con muy limitados recursos, no nos podemos dar el lujo de competir. Pero además la naturaleza propia del sistema socialista cubano y de la salud pública cubana, que es universal y gratuita para toda la población. Son instituciones que pertenecen al gobierno, al Estado, y nuestro fundamental objetivo es resolver los problemas de la sociedad. Es decir, no lucramos con los productos que desarrollamos y por lo tanto no tenemos este conflicto.
A mí nadie me preguntó cuando entré en terapia intensiva si yo era de izquierda, de derecha, ateo o católico, nada. Nadie me pidió una tarjeta de crédito, nadie me dijo cuánto me costaba la cuenta, nadie me dijo si tenía un seguro médico y me atendieron como si yo hubiera sido el paciente más importante del mundo. Así atendían a todo el mundo.
This idea of complementing each other was since the beginning of the Cuban Biotechnology. And this is the same what is happening now with the vaccine. I mean, it's not something new. It's a kind of a way of thinking, of behavior.
Cuba era un país con un 40% de analfabetismo cuando triunfó la revolución. Un país donde la ciencia eran iniciativas aisladas, no había instituciones científicas como tal, y desde un inicio, la mayoría de la población no tenía acceso a la salud pública, y desde un inicio la revolución priorizó la salud pública y la educación como un programa a largo plazo, un programa estratégico a largo plazo. Primero, alfabetizar a la población. Después, alcanzar diferentes grados de escolaridad. Después, que todo el mundo tuviera acceso a la universidad. Todo gratuito. Y ya cuando se logró tener una masa de personal universitario, instruido, pues entonces la prioridad fue el desarrollo de la ciencia y se comenzó a invertir en el desarrollo de la ciencia. Mucho se debe a la visión de un hombre, de Fidel Castro, su humanismo y su preocupación por el desarrollo social desde los inicios mismos de la revolución, y esto se programó, estructurado para un país con limitados recursos como Cuba.
The whole development of science and this biotechnological center has received a personal attention from Fidel. He visited all these centers. He would discuss with the scientists, and this was a message to the rest of the government. This is what is important. The future of the country has to take into account the development of science, of knowledge, of technology, and this is very important.
Es muy significativo a partir de los años 90, cuando ocurrió la debacle del sistema socialista en Europa del Este y Cuba se introdujo en una profunda crisis económica por la caída de las exportaciones en un 35%. En situación en que en cualquier país del mundo lo primero que se recorta son los presupuestos de investigación, de educación y de salud, en Cuba la prioridad fue la ciencia y desarrollar nuevos centros de investigación. En ese periodo se inauguraron nuevos centros de investigación y se dedicó recursos sustanciales a la investigación científica. Y eso ha sido una estrategia a lo largo de todo el periodo de la revolución que se ha cumplido y que permite mostrar los resultados que hoy mostramos.
Since we can say something like 81 have been using the very close collaboration of different entities, including scientists, in the struggle against the pandemic.
The fact that it's a centralized health system, which is free for everyone, universal coverage, allows an efficient deployment of whatever resources we have. We could do better if we had more cash to buy more materials. But the fact that we have a national industry that allows us to produce most of the medicines that are used for treating pandemics or epidemics or any kind of diseases, that we have a national production of different kinds of medicine, for example, for immunological tests, to see if antigens are related to any disease or the antibodies are circulating in the body. Every municipal has a lab. So as soon as they set up a test and they start manufacturing the reagents to do the testing, it's immediately distributed all over the country. So of course, it would be much easier if we didn't have such a difficult economic situation, and if we didn't have this continuous persecution by the U.S.
There's no doubt the United States increased its hostility towards Cuba during the pandemic time. Basically, they enforced 43 additional measures to the 200 blockade measures that were taken during Trump period. So we are talking that in the first semester of 2020, right, there have been 43 actions specifically designed to upgrade the siege against Cuba. I think that the United States government philosophy has been to the COVID-19 as an opportunity to enforce and upgrade the embargo or the blockade against Cuba. They made an assessment that the combined effect or impact of the U.S. blockade reinforced for the last 4 years, together with the crisis that a country will experiment at dealing with the COVID-19, will make Cuba more vulnerable in terms of its capacity to react to such a challenge.
El bloqueo nos ha afectado muy significativamente en el intercambio científico, en el acceso a recursos. Cuba está bloqueada financieramente en el sistema financiero internacional, en el acceso a tecnología, a la compra de equipos, sobre todo equipos alta tecnología que se producen muchos de ellos exclusivamente en Estados Unidos y está legalmente prohibido venderlos a Cuba, en el mantenimiento de los equipos, en el suministro de piezas de repuesto para los equipos, en la compra de reactivos, muchos de los cuales, o la calidad de los mismos es de empresas norteamericanas. Hay que comprarlos a través de terceros países, evadiendo el bloqueo. Realmente es muy complejo y implica costos muy altos este bloqueo, y realmente eso nos afecta muy significativamente.
It is true, as you know, that it harmed Cubans badly in terms of hardship, of the long lines that you see on the street, of days that we had a blackout, of days that a vessel could not touch Cuba, or touch Cuba but could not deliver their cargo, because at that time a phone call from Washington was made to Lloyd's or to any insurance company, and they were saying, hey, if this vessel named Claudia leave their cargo in Cuba, we will punish you, or we will take away, or we will put a fine on you according to their illegal biggest system of sanctions and unilateral measures that exist in the world.
Now we're back from Cuba, and we get to dive into a conversation with the co-producers of the featured documentary, Cuba and COVID-19, Health, Science, and Solidarity. Let me introduce this dynamic duo. Dr. Valia Rodriguez, a Cuban medical doctor, a PhD, and a neuroscientist. She is currently residing in the UK and doing research at the University of Aston in England. And we have Dr. Helen Yaffe, an economic historian at the University of Glasgow in Scotland. And in spring of 2020, Dr. Yaffe published her book, We Are Cuba, How a Revolutionary People Have Survived in a Post-Soviet World. Let's dive into the questions and try to keep us on schedule. My first question is for Dra. Rodriguez, a Cubana who studied medicine in Cuba and practiced for nearly 25 years as a medical doctor specialized in clinical neuroscience. And you've also worked at the Cuban Center for Neurosciences. We are also curious to hear your perspective on how Cuba's healthcare system is set up to provide healthcare for all. In the documentary, if you watch the whole 1 hour, there is conversation about the cradle to grave model, and said that Cuba has the highest doctor to patient ratio in the world. Tell us more about the Cuban healthcare system, and in that light, how is it set up to fight COVID-19? Why hasn't it collapsed like so many other health systems around the world, including in countries that are economic superpowers? Dr. Rodriguez?
Thank you, Angelica. Yeah, my microphone is on. Okay, thank you. Thank you, everybody, for being here tonight, and especially thank you for the invitation. It's a real pleasure for me to be here. So as our ambassador in the United States already said, the Cuba health system is universal, so free, everybody has access, doesn't matter your sex or political or ideological orientation or your race or sexual definition. So it's accessible for everybody. So the way that the system has been organized, that has been evolving along the years since the triumph of the revolution in the 59, but currently is organized in multiple tiers. At the top, you have medical institutes that offer a very specialized care to people, like Neurological Institute, Cardiology Institute. People go to seek for very specialized attention. And that is accessible, again, for free to everybody. It doesn't matter where you are living in Cuba. So then you have hospital at the province level and also at the municipality level. You have different type of hospital. One more complex than others, depending on the level. So then you have polyclinics, and these polyclinics are community-based clinic where the family doctors and nurses that we have a primary care system, they are attached to those small polyclinics. These polyclinics are like a hub that congregates or about 40 family doctors and nurse practice or offices. So the centerpiece of the Cuban system, and I think that is one of the key of the success, is that it's a community, it's a community-based first of all. So, and with that organization and working with the idea that everybody has the right for health protection and care, the state who provide all the resources and fund the health system guarantees the right to that, for the providing free medical care and hospital care at all levels. Also providing free dental care is also part of that system, promoting the different publicity campaigns for health education that are very important, because the Cuban population is cultivated, is educated around medicine and science, and that has been very important right now in the COVID pandemic, for example, for the acceptance of medication, for the acceptance of vaccines, for example, that is very well, inside all Cubans about the importance of science and health. And also, for providing vaccination, we have a very comprehensive vaccination program starting from when the baby is born, and also many other programs like for mother and child, for persons with different chronic diseases, and so on. So with that system, the population cooperates in all those activities, in the implementation of the program, that the program runs at the level of the community, through through social and mass organizations at the level of the community. So the neighbors organize and they help the family doctors and the nurse to run the program, so bringing child for the vaccination and things like that, like health education, meetings in the neighborhood for discussing benefit of different type of things. So that is the way that is run. So another important thing is the Cuban health systems emphasize in prevention. And that is the cornerstone of the system. And the prevention is guaranteed through the services that are implemented at the community with the participation of the citizen. And focusing in primary care is important, because then you understand the individual in all their dimensions, the biological, the psychological, the social dimension of individuals as families, as community. So the family doctor knows the population, knows the family, knows the diseases that they have. They are classified and they are being visited. So then that system organized in this way has a very close relationship with the biomedical, scientific, and educational sector. So everything that is produced in the biomedical sector or the scientific community, the main objective is to be applied to the public health system for solving problems that the population could have, or for preventing problems that the population has. And that has been a key during the COVID-19 in organizing the response and having our own medication that make us independent for giving a quick response to the COVID-19. And you will see that in the documentary if you watch. So together with that, when the COVID-19 happened, the government started to have meetings, and they call like a core group, where they were meeting with the leaders of all these institutions, and also established a daily communication with the population, explaining how the pandemic was going on, what's going to be the next measure, increasing the awareness of the population for social isolation and so on, and implementing very early and quick measures that with the structure of the system, with focus in prevention, the family doctors, and the communities integrated in that system, was easier. It was easier to implement. So I think that has been the key of the success of Cuba for controlling death and the spreading.
Thank you, Dr. Rodriguez, for helping us get that overview of the Cuban health system. And that's a good segue to my next question with Dr. Yaffe. Dr. Yaffe, help us understand Cuba. How are they combating the global pandemic? Tell us a little bit more of the achievements of their biotechnology industry, which Dr. Rodriguez touched on. Help us understand the 5 Cuban design, develop, produce vaccines, and what are some of the challenges they face? What's the impact that they are having to put their people first on the home front and also abroad?
Okay, I'd like to echo Valia by thanking you all. You've done an amazing job of organising this event, and it's great to have so many medical professionals who are on the front line here. And I would like to put my cards on the table and say I'm not a medic or a medical scientist. I'm a economic historian and political economist. So that's the perspective with which I have studied Cuba's biotech sector. So I'll start by saying something about that. It is quite extraordinary and globally exceptional. It is also Cuba's biotech development was the first time in Cuban economic history that it's been in the leadership of an emerging industrial sector. And this was very much, well, first we have to say a product or made possible because of Cuba's very early and very significant committed investments in education and in healthcare in general, but also the vision of Fidel Castro and the other revolutionary leadership of the importance of developing science and technology to put at the service of social development. So the biotech sector emerged in Cuba really from the early 1980s, before it was really developing even in Britain and Europe. So very early on, just 5 years after the first biotech firm was established globally, which was established by a sort of team of a biochemist and a venture capitalist. And that really set the characteristic for the biotech sector globally. It was about high stakes investment, profit seeking, private interest, and that has really characterized, certainly in the advanced capitalist countries, the nature of biotechnology. And the Cuban system, on the other hand, was established with 100% state investment, 100% state owned. It has over 50 institutions, research and development institutions in the Western Havana Scientific Pole, which collaborate. They meet and discuss how they can share and exchange resources rather than competition in the pursuit of profit. And really, for a country that has such scarce resources, that is blockaded, that has had access to modern technologies, even to scientific journals denied through the US blockade, that faces incredible difficulty getting the reagents that it needs for its drugs, getting finances, because Cuba is prohibited from international loans. So the first achievement is that Cuba has a biotech sector. Secondly, I would use up the rest of this meeting if I were going to go through and say some of the big achievements. But you have the world's first meningitis B vaccine. I'm going to really briefly summarize a few of them. In 1988, introduced to the public healthcare system 30 years before Britain. You have the world, first in the world to eliminate mother-to-child HIV transmission. You have the first synthetic antigen vaccine. You have Hep B. You have the Hiprapop P for diabetic foot ulcers, which reduces the need for amputations by 72%. So you mentioned this, Deborah. Well, someone's done the calculation. It's in my book. That would reduce by 52,000, something like that, the number of people in the US who every year have to suffer from amputations. So, you know, Cuba is really astonishing. The global South knows this. Before the COVID-19 pandemic, Cuba was exporting its biotech products to nearly 50 countries. They were being used in childhood immunization campaigns in Latin America and so on. So if in the context that you've mentioned 5 vaccines, it is incredible. There are only 23 globally that are at phase 3 level of clinical trials, and 2 of them are Cuban, with 3 more following in close pursuit, and lots of other adaptations that they have. But they also have drugs that have proven really useful, and I'd like to mention particularly just Vinza, which is seems to be part of the reason that the mortality rate of those infected in Cuba is so low. It's a drug that's been developed which reduces the inflammatory reaction of COVID-19 patients in severe conditions. And the whole world really needs, not just the United States, but, you know, globally, we need to be studying what Cuba's doing and helping Cuba, because Cuba has so many ways in which it can help the rest of us.
Thank you, Dr. Yaffe. I do wish we had all day and all night just to chat with this panel, this incredible panel of experts and doctors, women doctors. But I will keep us moving. Next question is for Dr. Rodriguez. There was a recent letter signed by 79 members of the US House of Representatives delivered to President Biden related to US-Cuba policy. One of the points made in this letter is the calling for engagement of medical cooperation, and that it should be prioritized at this time, especially in the fight to combat COVID-19. It also says these will be the initial steps, or should be the initial steps, for the ongoing process to seek an ultimate end of the harmful and extraterritorial embargo, also called the economic blockade against Cuba. So my question for you is, how are nations and people around the world working to build medical cooperation with Cuba to combat globally the pandemic, but also how are they working to pressure the United States to finally end its blockade on Cuba?
Yeah, well, I think the COVID-19 has been a moment where solidarity and humanity and kindness has been shown in many occasions. And one example, for example, I want to start mentioning is that very important institution has been sharing work or designs to help, for example, when the COVID-19 started growing, the pandemic became a pandemic, one of the problems was the availability of ventilators. And then the system were collapsing because there were too many people in ICU and ventilators were not enough. And then organizations like, or institutions like the MIT in Massachusetts or the UCL, the University College London, they developed their own designs and they published the design on in the website and offer for free. There was an open design that was available for the whole community. So that is a way where cooperation was shown. And then using that kindness, or making, taking the benefit of that kindness, Cuba started to develop their own ventilators using the designs from UCL and also the design offered by the Massachusetts Institute of Technology. So going a little further on that, then they established a collaboration between UCL and the Cuban Neuroscience Center that is leading the development of CPAPs, that is a type of ventilator that is non-invasive, as the nurses that are here all know what I'm talking about, this non-invasive ventilation using positive pressure. And they established that collaboration to go further in the project for the developing the proof, the different proof, improving the design in the Cuban conditions, and so on. Later on, there has been money that has been offered by different association. And right now, for example, there is also a joint project between Oxford University and also, for example, the Cuban Neuroscience Center for doing joint research in the COVID-19 complications, neurological complications that the patient could have seconds after they are recovered for the acute for the acute disease. So those are examples of collaboration during COVID pandemic. So in the case of the US, collaboration in the medical field and in the scientific field, they have suffered because of the US embargo from the 60s. So, but that doesn't mean that the cooperation doesn't exist. The cooperation exists, and actually the development of interferon, that today is a recombinant variant of interferon that what we have in Cuba. So they started learning about interferon, where they were, and production of interferon, going to the United States and exchanging with colleagues that at that moment they were leading the field. So and like that. So, but still, always there has been visits from scientists, exchanging information, training with the difficulties of the blockade, but they have been established. During the COVID-19, however, and despite all the measures that the Trump administration has put in place on Cuba, they have tightened the blockade and the difficulties in the country. In December 2019, was held the first joint meeting between leaders of the public health, Cuban public health, doctors and nurses with the University of Minnesota. And the second one will be at the end of April. That is an example how still cooperation are. And I think science and global health diplomacy is the key. Is one of the key to restore relations and to demonstrate that both countries could benefit from the end of the US blockade on Cuba. We have, for example, Cuban products that are on clinical trial in Roswell Park in Massachusetts for cancer treatment, specifically for pulmonary cancer treatment. That is a compound, that is a type of treatment vaccine that has been in clinical trial there. Could be many other Cuban products that could enter to the US market and benefit and be of benefit for the population if this situation about sanctions, restrictions were not in place. I don't know if I have more time. I know time is restricted, but I also want to mention very brief the role of the solidarity movement, helping Cuba always. That is an also very important arm, of medical cooperation and help.
Thank you, Dr. Rodriguez. So my next question, Dr. Yaffe, I just want to highlight that you've added your voice to the growing arm of solidarity and the growing call, international call rather, urging the Nobel Committee to award Cuba's Henry Reeve International Medal Brigade the 2021 Nobel Peace Prize. I want to shout out to some of my friends who are watching, who are part of the active US-based campaign that has received nearly 40,000 signers on a petition going to the Nobel Committee. And there are movements from Greece to South Africa that we also stand in solidarity with that are also campaigning for this. So with that said, can you talk a little bit about the significance of the medical internationalism in general and the role it's playing during this pandemic?
Okay, it's a great question. So just to sort of put it out there, so we get an idea of the scope that we're talking about with medical internationalism from Cuba. Before the pandemic, 400,000 Cuban medical professionals had worked in, I think it was 164 countries over 6 decades. So that is an astonishing accomplishment for a small Caribbean island of 11 million people, which found itself at the outset of the Cuban Revolution with a little over 3,000 trained physicians after half of them left in the first months and years. So Cuban medical internationalism first started in 1960. So despite, you know, this was not a question that Cuba could afford surplus medics. It couldn't by any means. And yet there was a terrible earthquake in Chile and they sent a team out there, emergency assistance. But then they also were assisting the Algerian struggle for national liberation. And as part of that, they brought some of the some orphaned children and some of the soldiers back to Cuba to give treatment. And so this first developed. I think this is important to point out because we have to understand that Cuba's medical internationalism is not seen as under the paradigms of like modern aid paradigm, which actually is very disingenuous and is often not really about helping nations, but about locking them into sort of long-term debt and so on. But Cuba's approach to medical internationalism is linked to its commitment to social justice and economic equality globally. And it sees the struggle for national independence against colonialism and imperialism as part of the same struggle against the global conditions which lead to poor health, poverty, and, you know, this terrible scenario where you have every few minutes children dying of malnutrition and diarrhea completely unnecessarily. So you know, that's the sort of ideological or political motivation behind Cuba. Some people say it's that also Fidel Castro suffered from the syndrome of C-ism. He could not say no whenever he was whenever Cuba was asked for assistance. But there are four forms of Cuban medical internationalism. The first I already mentioned was the emergency response to situations that happened. And I think, you know, the COVID-19 pandemic would fit into that category. And someone in the chat has already mentioned that Cubans were in the front line against the Ebola epidemic in West Africa in 2014. But they actually have been all over the world. Every year there have been Cubans responding to natural disasters or disease outbreaks and so on. So they have a very special knowledge and expertise in this area. Then you have the assistance that Cuba has given for helping to set up public healthcare systems. That first started after Algeria became independent in 1963, and they sent a team there. But we've seen that more recently and in a very extended, you know, large scale in Venezuela, where the Cubans have been there helping to set up the missions to establish public healthcare system there, and has sustained over 20,000 medical professionals in Venezuela now for nearly 2 decades. Then there is the treatment of foreign patients in Cuba. So, you know, recently we had the anniversary of the Chernobyl nuclear disaster in Eastern Europe, but hardly anyone mentioned the assistance that was given to the victims of that, particularly children, by the incredible program, Children of Chernobyl program, set up in Cuba. 1989 it started, just on the eve of Cuba's severe economic crisis, which happened just after the collapse of the Soviet bloc. Cuba's GDP plummeted by 1/3. They were struggling to feed themselves, and yet they maintained this program, so that within 21 years, 26,000 people from Ukraine, Russia, Belarus had benefited from Cuban medical assistance on the island, and the vast majority of those were children. And then there has been also training students from overseas. So now, and I hope we're going to hear from Christine, who is a graduate of the Latin American School of Medicine. Literally tens of thousands of young people from around the world have had the opportunity to study medicine, and most of them come from the backgrounds which would make them which would block their entry into medical profession in most of the world, where medicine is commodified, where it is it is distributed on the basis of a market. So incredible story of Cuban medical internationalism. The ambassador, I believe it was, who already mentioned that Cuba has now at this point, just over a year into the pandemic, sent 57 brigades of, these are specialists, these are people who are trained to deal with disease control and disaster response. The first brigade went to Lombardy in Italy at the time when it was the epicenter. And I remember watching on the television, Italians saying, where is the rest of the world? Where is Europe? They've run away. Well, the Cubans ran to the disaster. And that has been, a feature of Cuban medical internationalism. And we have in the documentary one of the medics who went there talking about it. He also was someone who'd been to combat Ebola in West Africa, and he explains his motivations. It's very moving, so I encourage you to watch that.
Thank you, Dr. Yaffe, and thank you, Dr. Rodriguez. That was a perfect introduction to deepening and broadening this transnational conversation, and to add the really unique perspective from somebody from the United States. So I'd like to first welcome and thank you, Dr. Christine Knight, for taking time today out of your critical frontlines work as a resident doctor at St. Mary and Elizabeth Medical Center on the west side of Chicago. Dr. Knight graduated in 2019 from Cuba's remarkable Latin American School of Medicine, ELAM, where she spent the last 6 years living and studying medicine in La Habana. As Dr. Yaffe mentioned, ELAM has graduated tens and thousands of physicians coming from these very vulnerable communities that have been underserved throughout Africa, Asia, the Americas, and the United States. So these students, like Dr. Knight, receive a full medical education scholarship thanks to the Cuban government. And in return, upon graduation, they make the commitment to go back and work in the communities that are underserved and that have shortages of primary care doctors. In many cases, they return to their own home communities. And those of you who are listening, the numerous nurses that are working in the United States, you know all too well that this pandemic is radically exacerbating the deadly consequences of racial and socioeconomic disparities in the health and the healthcare in the United States, creating what they say is a crisis within a crisis, especially for people of color. Dr. Knight, you are currently a resident doctor in Chicago in the midst of a global pandemic. Tell us a little bit about the community you are serving and what elements of the Cuban medical education system has proven helpful in navigating our current health crisis. Welcome.
Thank you so much. I want to say thank you to you all organizing, and it really is an honor to be here with you all, with everyone doing all the great work that they're doing. I also always want to thank IFCO and everyone at Proyecto ELAM, because we would most certainly not be here without them. So yes, I have the honor to be a part of a community-based family medicine residency. We are work in our hospital training out of St. Mary's Hospital, which is on the west side of Chicago, and then particularly in the Humboldt Park neighborhood. And then we do our clinic and continuity training out of a federally qualified health center called Prime Care. So sadly, we are in some of the community that we work with are definitely at baseline very vulnerable communities and have been hit some of the hardest hit communities in the city. So I am honored and very grateful to be working with many like co-residents and many of the attendings and doctors and nurses who are definitely putting a lot out there to work with everyone. And I think as President Berger mentioned, definitely it's not easy, but I'm very grateful to be here. But yeah, I think definitely a lot of my interest goes into that second question, which is definitely asking the question of, what are the things that we got the opportunity to learn, and what that can do, especially in moments like this, both in Cuba and outside. And I think I definitely want to start, which I think many of us did, is emphasizing that when we're trained in Cuba, and everyone who trains in Cuba, we are trained under the premise that healthcare is a human right. And I think that what that does, I think, not only in our perspective of providing, but in the perspective of someone who enters into a system, engages with healthcare on the idea of healing. And so if you can only imagine, if you are a part of a system that believes that healthcare is a human right, it already sets the premise of what, healing is and what's expected. And I think that very much changes the potential of healing. But then on top of that, I think that it has built an infrastructure. It is a system that is very much aware that if healthcare is a human right, and it does believe in what many people mention, like these social determinants of health, it doesn't just address the issue of, like the medicine you need and all of these other things. It addresses food, it addresses housing, it addresses a whole infrastructure that then leads to this further capacity to heal and to not just because it's not just the absence of sickness, it's the presence of health, right? And so I think that that infrastructure and that choice to go that route is something that very much changes the potential and capacity. And I think on top of that, I think that that's part of like what has been so hard and difficult in our community, especially in, because we have the hospital experience, but we have the outpatient clinic experience. And so part of the difficulty and part of what I was so grateful to have in Cuba and to learn from is that when people come into the clinic, they're not, part of why this is such a crisis is not just because they're maybe they have COVID or they have had COVID. It's the enormous crisis that we're facing in, they've lost their jobs, they've lost their sense of security of housing, they've lost their, security of food. And I think that then snowballs into a further crisis that affects mostly populations that were already previously vulnerable. And I think that this moment has really exposed just how vulnerable, communities are within our country. And then I also want to mention something that I know many doctors in Chicago, especially Dr. Howard Ehrman and other, I'm sure doctors other places have been, talking about a skill that we learned in Cuba, which is pesquisaje. It's like screening and popular education. It is built in, Cuba's medical system is born of the idea of capacitating medical professionals to learn public health, to learn these tools. We learned what is isolation, what is quarantine. These are concepts in public health. And sadly, it took months before our infrastructure was capable of doing things like contact tracing and doing door-to-door popular education, things like that. Even though, we had docs here early on pushing for that, and understandably so, because they are built into the infrastructure within Cuba, and we are trained how to do that within Cuba. And they are skills that are essential at a time like this.
Thank you, Doctor. So I have one last question for you directly, and then we'll open up to some Q&A from the audience. But let me ask you this. Let's all imagine that President Obama had actually ended the US embargo blockade when he was in the administration. And with that in mind, how do you think the impact would be on the community that you're serving in the midst of this international health crisis? How would it look different? How would the impact be different in terms of medical cooperation between the United States and Cuba?
Yeah, I think that's a beautiful thing to imagine. So I think that I mean, I think it's like a lot of what we're saying. I think the saddest part to me, and I think many of the health professionals on, you know, with the whole nurses union, I think the saddest thing too that a lot of us have is it is heartbreaking. Like, so much of this didn't have to go this way. And I think that it would be beautiful to imagine, you know, from the beginning, similar to what Cuba did internally. You know, Cuba, they always talked about some pandemics and people getting sick, that in and of itself is not crisis. Crisis is not being able to respond to that illness. And I think that that has really touched me in this moment, because I think that we didn't respond how we needed to. And I think that we're still struggling to respond, and we're playing catch up in so many ways. And so I think even just, you know, I think that Dr. Yaffe had mentioned it, and Dr. Rodriguez, is like that infrastructure that is established, and that sense of a capacity of, you know, we just missed the ball on this moment of having international solidarity. And I believe that, you know, in so many, and I mean, I'm talking about in medicines, I'm talking about in vaccines, but also just in literally, like, Cuba sends professionals to come and help build infrastructure of healthcare systems all over the world. And you see incredible changes in those systems. And we really did need that. We needed that in this moment. And I think that we would have skipped so much heartache and so much sadness and loss. And I think that we would have learned and kind of just like shifted our focus and helped ourselves realize moving forward that, you know, public health is important, and these vulnerable communities, they count. And yeah, I think it would have just been very different and beautiful, but I think there's still time. So I think that moving forward, that's why we're here.
Because everything you're sharing, all of you, is so critical for our audience to hear. And I'm being, my timekeepers are keeping me, and we are quite over time, but I do want to present 2 questions from our audience. And I want to thank you, Dr. Knight and Dr. Yaffe and Rodriguez. And our first question is for the Honorable Ambassador. If she's here, if not, we can flip it. There we go. And this question is from our audience, Ambassador. Will the Cuban vaccine be available to other countries, and especially to people in the United States who want to travel to Cuba to get vaccinated? No te escucho.
Well, as I said, the information that we have so far is that we'll have our population vaccinated by the end of the year. And we are working to fulfill that goal. Let's see after that. We don't know yet. I think in the spirit of solidarity that is in our country and is part of our government and the Cuban Revolution, we wish we could do that, and we could share our vaccine with as many people and countries as we can. But now we have to focus in the clinical trials that we are now developing now, and then let's see after this. Yeah. Thank you.
Thank you, Ambassador. So my last question is for whoever would like to answer it, very briefly, and maybe it's just a couple sentences from each of you. Why should young people in the United States care about Cuba?
I could definitely speak to that. I like to consider myself still young. And I think that, you know, I think it goes back to, we're in a moment in the US that I think young people are like starting to say what needs to be changed and changing it. And I think that anytime you're in a moment like that, we need different perspectives and we need creativity. And I think that's the other beautiful part about ALAM is that it's a system that is an international school. It brings the people at different experiences, different cultures, different backgrounds together. So it's not just we're studying, but we're also sharing those experiences, and it just leads to an insane degree of creativity. And I think the Cuban system has been creative for so long. And I think that that is a system that has been resilient and I think really proven that it has, you know, like taken like so many from so little resources, it has created so much. And I think that we need that inspiration. We need that creativity. We need that idea base, especially now in this country. I think that now more than ever is the time for a solidarity with Cuba.
I think that it's important for young people to really care about what's happening in Cuba, because it gives us people in the United States a real proof of what really is possible in our country. We have many politicians that tell us that it's not possible to have Medicare for all, it's not possible to have education above high school for all, it's not possible to do all these things. But a country with fewer resources that has been in dire straits for so long has proven that it is possible if you have the political will. And so I think that that is key for people to understand. So Cuba is this example that should be held up to show that a country can be compassionate and a country can do the right thing if they have politicians that really care about their citizenry.
Thank you, President Berger. That is a wonderful transition to our calls to action and our concluding remarks. Unfortunately, we are coming to the end of our program, folks, but I want you guys to stay on with us for just a little bit longer, because we really do hope that this conversation today provided you a better understanding of Cuba's health system and some of the valuable lessons as our doctors all and our nurse all helped go deeper and in how Cuba is confronting and combating COVID-19. As a popular educator myself, I actually hope all of you log off with more questions and curiosity than when you arrived. And to help answer some of the lingering questions, I've got a fabulous team who will be sending out a follow-up email with a ton of resources so you can further your studies and engagement. We have reopened the chat, or maybe it's been open the whole time, so folks can exchange in a friendly way there and share upcoming events. We will keep it open for about 15 minutes following the event. And we just want to really deeply honor and thank all of our speakers, all of the co-sponsoring and endorsing organizations. I mean, like, look at that list there. Our 2 interpreters that have been working hard. And of course, we want to thank all of you who are watching around the world. It will take us coming together as a unified global community to not only confront the global threats of COVID-19 and future pandemics, but also to address the critical issues of our lifetime, such as the global climate crisis and protecting our sacred earth. So we have a collective call to action, right? And now we'd like to take some time to briefly share some ways you can get actively involved. So sit back, including our speakers, relax. You don't have to take notes. Again, we will send out an email with all these important details. But first and most urgent, the US-based Saving Lives campaign is organizing an urgent initiative to send desperately needed syringes to Cuba. As you heard, Cuba has an ambitious plan to vaccinate its entire population of nearly 12 million by the end of the year, and has plans to produce 100 million doses that it will be sharing with other developing nations in need. And with those plans, which is an incredibly important act of global solidarity, Cuba needs 20 million syringes. So we're asking you all to help today. The campaign's initial goal is to raise 100,000 this month for approximately 3 million syringes. You can make your pledge to Syringes to Cuba on the Saving Lives campaign website, and it is tax deductible. So check out the website. And we also invite you now to learn about some ways you can join advocacy efforts from the local to the national level. So there has been some 26 city council, labor councils, state legislators, along with school districts across the United States that have passed resolutions to promote medical cooperation with Cuba. I want to say a shout out to the Chicago City Council because they are the largest US city to have passed a resolution calling actually to end the US blockade on Cuba. On the Saving Lives campaign website, there's a toolkit that will support you through the process from drafting the resolution to the actual passing of the resolution. While it's very important to echo the demands of local elected officials, we have a lot of work to do on the national policy front. So we formed the Alliance for Cuba Engagement and Respect, aka ACERE, in the mid of last year, urging the US Congress for an immediate easing of sanctions against the island and to help our Cuban brothers and sisters confront the economic crisis caused by this pandemic. Our goal with ACERE is to channel the energy of thousands of grassroots advocates across the US to achieve bold and progressive policy changes that promote positive and respectful US-Cuba relations and ultimately an end to the blockade on Cuba. I mentioned briefly the letter, the congressional sign-on letter. Well, that was ACERE's first initiative with working with our allies on the Hill, along with grassroots advocates across the US. There were 79 congressional House representatives that signed on that letter telling Biden to not delay executive action, to reverse the Trump administration's cruel sanctions against Cuba, and to engage in medical cooperation, particularly now in the midst of the pandemic. So we did that, but we need your support to turn up the national heat. So check out our website. There you will find you can sign up for our actions alerts, and we invite you to join our working groups to do targeted grassroots outreach to members of Congress and to the Biden administration. As President Biden approaches his 100-day mark in office, ACERE is concentrating on holding the president accountable to his campaign pledge on Cuba. We cannot waver our demands for the president to act now. And we are also on the Senate front asking grassroots advocates to contact their senators, their US senators. Each state has 2, so all you have to do is make 2 phone calls, 2 emails, and asking them to co-sponsor the US-Cuba Trade Act of 2021. That's Senate Bill 249. Again, we'll send this in an email. So we invite you to join. And we also know that not everybody loves policy Washington trench work. So if that's not your thing, we invite you to join us in the streets demanding change alongside the people. And we encourage you to join one of the many car caravans to protest the US blockade happening in 23 cities across the United States, Canada, Africa, and in Cuba. And it happens on every last Sunday every month. The idea for these car caravans was born out of love by progressive Cuban Americans from Seattle to Miami who did not want to see their families suffering on the island due to the increased sanctions of cruel US policies. And lastly, it takes 2 seconds to sign a petition to honor Cuba's long history of medical internationalism and to tell the Nobel Committee to nominate Cuba's Henry Reed Brigade for the 2021 Nobel Peace Prize Award. So those are our calls to action. And as we conclude, we're not doing bad on time. I want to also remind folks that today is the 61-year anniversary of the first brigada of young Cuban volunteer teachers, maestros y maestras voluntarias, who bravely and heroically set out into rural communities across the island to lay the groundwork for what became the massive national literacy campaign of 1961. These young volunteers, these young people also became the first public health workers in these very isolated rural communities and areas of the island where health workers had not existed pre-revolution. I mention these young people, these young teachers, because not only did they pick up pencils to teach literacy, but also syringes to help mass vaccinate the population at the time. So today we honor their dedication to educate the masses, and I leave us on a revolutionary spirit note. We too have a mass education campaign to lead. So I thank you all for being a part of it. And again, thank you to all of our speakers and our co-sponsoring organizations and everybody who helped work to put this together.
Thank you.